I've always been self-conscious of my nose since I was about 12 or 13 years old, ever since I started to develop a hump on the side. So you can kind of see right here, there's a bump here, and it's not completely even on both sides, so it makes it so that my nose is longer on one side than the other. I chose Dr. Buonassisi because he's a board-certified facial plastic surgeon, and he's one of the top plastic surgeons in Canada for rhinoplasty. I really liked the before and after pictures that I saw online, and I had a really good consultation when I came in, and I just felt right. Although I am a little bit nervous for tomorrow, I'm totally confident in my doctor, and he's answered all of my questions that I had. I find that I have so much more confidence with my new nose, like before in photos, or like every time I had somebody sitting next to me, I just think about it and think about what my profile looked like, and now like it doesn't even cross my mind. Like it just feels like a new perfect face, so yeah.
All right, Lily, so we're here at your post-op visit now. How long has it been since your surgery?
About 2.5 months now.
2.5 months, okay. And you're noticing that the swelling is starting to get better but fluctuates day to day. That's pretty common.
Yeah.
So if you do too much exercise or something, it'll puff up a bit.
Yeah.
That'll stop happening, but that probably takes about a year or so to do. So what we did with at your surgery, as we had planned, was we brought your bridge down. I mean, you had a very nice nose anyway, but there was a couple little things that bugged you, and one of them was the hump. And I think, I'm not sure if you identified it or if we identified it during the consult, but I think your tip needed to come up just a tiny little bit as well.
Yeah.
Just to give you a bit more of a feminine angle to your nose. That has the effect as well of shortening your nose by bringing the tip a little closer to your forehead.
When I look in the mirror, I still totally feel like I look like myself, just like a little bit improved. And my parents were really worried before I got it done. They're like, oh, you're not gonna look like yourself. Like, what's gonna go, like, what is it gonna look like? Like, we've looked at your face your whole life. Like, it's just gonna be weird for us, and like they barely even noticed. it was just me who noticed.
I think that looks good. Are you still a little bit tender?
Just on the end here,
okay.
But here's totally fine.
Okay.
Like when I tape it here at nighttime, it like doesn't hurt at all.
Perfect.
Yeah.
So what we asked you to do afterwards is just to sort of tape the area to kind of compress any scar tissue that can form. And I think it just helps to mold your nose a little bit. So there's just a little bit of extra intervention that you can have post-operatively, because once we're done the surgery, we have no more control over it. But
the staff at the clinic were awesome. Like, I loved Alex and I loved Sarah. They were both like really, really personable and made me feel like I was one of their friends, and that I could like text them for anything if I had like any worries like last minute, then they'd totally be super helpful. So just on the inside here, it's a little bit more swollen than this side, and I just wanted to make sure that that's okay.
It is, and in fact what it is that the stitches that I use to hold your tip up are put through and through the nostril, but they're always tied on the left.
Oh,
so there's little knots in there, and they sometimes will irritate the walls. They dissolve, and so eventually they'll just fall out. But they probably last for 4 or 5 months. And that's probably the most common thing patients ask me about. They're not worried about it, but they often say, hey, I sort of feel stuff on my left more so than I do on my right.
Like up here?
And it'll actually even touch the walls a little bit as well.
Oh, okay.
Yeah.
I had my nose pierced on this side, and
you
now
had
it's
before?
over.
Okay.
How long should I wait until I can get it re-pierced?
Oh, you can do that now.
Now?
No problem.
Really?
Yeah.
Oh, okay.
You can get it pierced again. You can wear glasses again.
Oh, yay.
You can do everything except kickboxing.
Okay.
Yeah, that you can. That
Sounds good. My advice for somebody who wanted to have a rhinoplasty would be definitely like do your research and find the right doctor for you, and wait for a long enough time so that you know that you for sure want to have it done, and know that you're doing it for the right reasons.
I don't think you look like you had surgery, and that's my most important thing. When I see patients, I want to make sure there's nothing there that would suggest that they had surgery, and I think that's the case for you.
Yeah. I love my results. Honestly, it gets better every single day. Like I love it.